Hola a todos, mi nombre es Katrina Espinar, soy de la Universidad Complutense de Madrid y a continuación os pondré la perla llamada ¿Por qué es importante hacer un estudio radiológico del polígono de Willis antes de una intervención quirúrgica? El papel de las variaciones anatómicas. La exposición la voy a hacer en inglés y la presentación estará en español para facilitar su comprensión. De todas formas, si alguien tiene cualquier duda o cualquier cuestión, puede escribirme a mi correo electrónico que lo pueden encontrar ahora mismo en pantalla. From 1 to 5% of the population will suffer an aneurysm throughout their lives. Within this percentage, 85% will suffer it in the cycle of Willis. The motivation that constitutes the genesis of the project I'm going to talk about is based on the fact that neuroanatomy presents a wide range of patterns of variation. Agenesis, atrophy, or increased development, or just bifurcation, are some of the variations that we can find in any of the anatomical structures. Hence, the importance of its study, because its direct involvement in treatment, and especially in surgery, will imply a higher success rate in the case that they are known, as well as its anatomical correlation with different disorders or diseases and their involvement. So we can say that the clinical implications will be vital for the patient. Besides, it's important to highlight the special importance of the study of anatomical variations of the pattern for the subsequent involvement, because many of them cannot be anticipated with paraclinical studies before the performance of the surgical intervention, as many authors point out. So, what is the cycle of Willis? The cerebral arterial cycle, also called the cycle of Willis, is an anastomosis circulatory system that supplies blood to the brain and surrounding structures. So there is no denying the fact that the different patterns can help predict the necessary variations that we must provide the patient in terms of treatment, as well as the support that this will need in it. Added to this, it not only practices treatment but the progression of the disease of disorder. This is because there is a direct correlation of sensory-motor processes and cognitive function with different brain structures. We should also bear in mind that knowledge of variations will help predict who of the patients has responded to the neurosurgical treatment or procedure. In addition to this, it should also be noted that the variations in intracranial circulations occur with a high frequency, as it will be far elaborated in this introduction, due to the low incidence of what is considered to be the normal pattern of the cycle of Willis, which is just from 5 to 30%, which is ridiculous. A clear example of this is the cycle of Willis, which is an arterial anatomical structure in the form of pentagons located at the base of the brain. It consists of two posterior cerebral arteries, two posterior communicating arteries, two anterior cerebral arteries, and an anterior communicating artery. Its main function is to irrigate the brain and perform vascular substitutions between the carotid and vertebral system. Its classical pattern, however, despite being treated as such, only occurs in a mere 5 to 30% of the population, as indicated by numerous anatomical studies. So, therefore, since the scientific literature often refers to its variability and the relation that this system has with cerebrovascular pathologies, the importance of the anatomical study of its variation for the diagnosis of them is remarkable. This study often becomes more important, if possible, when it is necessary to carry out a surgical intervention with some incidence or cerebrovascular relation. However, this so-called anatomical study often is not possible, but is supported by radiological tests, whose problematic is that these are not performed in a systematic manner, which may lead to biases in clinical practice. However, it should be mentioned that the interpretation of such radiological tests and the study of the different patterns underlies a previous study of the pattern in Cordova, as the one we are carrying out. So why is it so important to study the cycle of Willis? Just because 85% of brain aneurysms develop in the anterior portion of this structure, and they affect internal carotid artery and its intracranial branches. So then, it's very important, especially if you think of it like the cycle of Willis has anatomical variations in more than 65% of the population, which means that only 5 to 30% of it has the classical or normal pattern. Within it, the anterior sector is the most variable one, being where 80% of the intracranial aneurysms are, In addition, it's important to highlight the clinical surgical implications of each of its versions in the vascular tree. To exemplify this in the case of aneurysm, the fact that this so-called anatomical structure represents a hypoplastic artery of the lack of anastomosis means that the efficiency of the replacement is reduced or repressed, and even in the case of vasospasm, increased ischemia area. Uh, this means that it's necessary to know the possible variations, since not always the paraclinical studies, including the neurological ones, are able to detect them, which could have great consequences. For example, during surgical dissection of an aneurysm, one of the vascular variants may be compromised by a surgical clip into areas of ischemia or infarction. In these cases, the consequences are pretty serious, as you can imagine. So you may wonder how we study all this. We carry out a triangulation methodology where we compare the results we get by radiological studies, the results obtained by the dissection of the brain with microneurosurgery techniques by using dissection material for microsurgical surgeries, and the use of a surgical microscope and the scientific literature. And the results, which are by now intermediate, are proving that there are new anatomical structures, new patterns, which have not been studied yet. It means that this study is of utmost importance. So, what's the take home message? So, first of all, that 85% of brain errors develop in the anterior portion of the cycle of Willis and affect internal carotid artery and its intracranial branches. And secondly, is a study in cadaver is fundamental and cannot be replaced by any other, although it can be supported by neuroradiology. So thank you very much for your attention, and if you have any further questions, you can find me there on Twitter or on Gmail. Muchas gracias por vuestra atención, y si tenéis alguna otra cuestión o alguna pregunta, podéis escribirme al correo electrónico que aparece en pantalla o podéis encontrarme en Twitter en el usuario que os pone también en la pantalla. Gracias.